Hello, everybody. In this new series of interview, we have Mr. Vinay Gupta from Delhi with us. He will be sharing with us today about medical astrology. Mr. Vinay Gupta is a well-known personality in Delhi, and he specializes in medical astrology. In relation to the video that he is doing with us, again, as all the astrologers on Saptarishis, they do not get paid. It's out of their love towards astrology that they come forth and share their knowledge with us, so that everybody who wants to learn astrology or want to know more about this subject do know about it. And today we have him online with us, and I now hand over the entire interview now to Mr. Vinay Gupta to take it forward and share about medical astrology with us, his knowledge. Mr. Vinay Gupta ji, welcome on board.
Thank you, Vital ji.
Yeah.
First of all, I pay my gratitude to my Yogi Guru Shri Raos ji, Sunil ji, and yourself, as well as Saptarishis Astrology, because you have given me a chance to share my knowledge. So my gratitude to all of you.
Thank you so much, sir. Yeah.
Okay.
Yeah, please share with us your journey in astrology, and you're taking it so seriously. And yeah, your guru is, you said, K.N. Rao ji, so please tell viewer about your journey in astrology, and then we will touch on the subject of the medical astrology.
Okay, Vital. Actually, as a child, I used to go along with my father,
Okay.
to one astrologer who hails from the Mathura,
Okay.
to his temple. So I was very keen to know what will happen to me and other things. Everybody who wants to know it.
Okay.
Later on, my parents sent me for studying medical in Aligarh Muslim University.
Okay.
But I was keen to do engineering. So after pursuing 1 year at Aligarh Muslim University, I basically I ran away from Aligarh Muslim University
Okay.
and came to my house and told them that I will not go there again.
Okay.
So they have given me chance to pursue in Delhi University, go in the biology side, because otherwise 1 year would be wasted.
Okay.
Then after one day we were at the hospital. My second child was going to be born.
Okay.
I was sitting along with my wife, and we were. I have seen one advertisement of Bharti Vidya Bhavan.
Okay.
So I asked my wife that should I join this course, because I was keen to know about certain things.
Okay.
She said okay. So from there, on the last day, I filled the form and joined Bharti Vidya Bhavan for 2-year course.
Okay.
At that time, it was Jyotish Praveen and Jyotish Vishal.
Okay.
So that I come to in the contact with Shri K.N. Raos ji.
Okay.
That is my journey, and later on, as the time passes out, so dasha changes. So basically, if I say I repent on my decision to run away from the medical field, I did not repent, but somehow it pinches me in my heart that maybe I should have done that. So here Raos sir given me the chance to teach medical astrology,
Okay.
because there are a number of classes. We
Okay.
have only one teacher who is teaching medical astrology.
Okay.
So that's how my interest come in the medical field. And after my retirement, I am still thinking that I should I will be joining some Ayurveda course or homeopathy course so that I should be a qualified doctor.
Okay.
That is
Great.
my ambition.
Okay.
Yeah.
Yeah. What are you going to share with us today, sir? In medical astrology.
See, in medical astrology, first of all, I think that it will be probable that for an astrologer, either a patient will come or someone who is knowing the patient, he will come to ask about his illness or treatment, etc.
Yeah.
And so, what is the assessment area that we have to do beforehand, before venturing into the horoscope?
Okay. Okay. So, do we
So,
put
first
down,
of all,
yeah, do we put down the slide
yeah,
for the viewers so
yeah,
that
yeah,
they
yeah.
can go through it?
Yes, yes.
Yeah. Yes, Vinay ji.
Yeah. Move on to the next slide. This is the introductory
Yes.
that I'll be sharing some views on medical astrology.
Okay.
Yeah. Go on for second slide, sir.
Yeah. Is the second slide visible now? Yes.
Yeah, yeah, yeah. I'm seeing.
Yeah.
For any astrological and medical diagnosis of any disease, the contributing factors are: first is onset of the disease or timing of the disease.
Okay.
This is the area, basically, this is the area where where astrology is the strong force. In this area, basically with the help of the ephemeris and on the analysis of the horoscope, we can time the period when the disease will get onset.
Okay.
So, with the promise, which is static, of course, that is static, and dynamic is the dasha and transit. So, correlating all the three, we can forewarn a person that this time is the time when you can caught the any such disease.
Yeah. So
And
okay. So
yes,
so the timing factor becomes very critical, and I think yeah, as you said, from the dashas and from the gochar, that is transit, we can proactively be able to tell somebody that during this time, this period, yeah, these kind of issues could happen. Again, the yoga, the classical yogas would also, the planetary combination would also play a
yes.
role to say what type and those things. Yeah. Yes, sir. Go ahead. Yes. Yes.
Yes, definitely. That is the part of the promise.
Yeah.
Planetary yogas and planetary combinations,
Yes.
they are part of the promise.
Yeah.
So, in this timing also, astrology versus medical fraternity. Medical fraternity means all those who are qualified to do the diagnosing of the medical
Yes.
or treatment of the medical. So they are bit weaker in this area because they can't find out that you can have some disease after 10 years.
Yeah.
So that is our force. So basically, astrology, for astrology, this is our force, that we can time the disease beforehand with the help of ephemeris and all the planetary combination.
Yes. Perfect.
Next is your analysis of the disease. That is means diagnosing and nature of the disease. Here, basically, we are somewhat weaker in this area because we can diagnose the area where disease could be taken place.
Yeah.
But there are certain astrologers like Raos. Raos, he can pinpoint the area as well as he can pinpoint the disease.
Oh, okay.
Whereas, as a general student of astrology, we can pinpoint the area. Like if we can, if the fifth house is activated, then we can say some disease in the stomach,
Yeah.
or the more we can say that it should be a liver disease or in the pancreas or the gallbladder. We
Okay.
can pinpoint these things, but in stomach there are thousands of diseases.
Correct.
This is the fort of medical fraternity. Basically, they can diagnose properly
Yeah.
in this area.
Yeah. Yeah. So we can tell a person that there could be after 10 years a problem in your stomach.
Yeah.
What exactly is
Stomach.
only, yeah, we can, as an example I'm saying, that we can tell them, yeah, there would be stomach related ailments that you will encounter or problem that you could you encounter 10 years from now.
Right. Right.
But what exactly it's going to be, only the time when it happens will the doctor will be in a precise position to say, what kind of stomach disease are you having,
Yes,
But-
we have to analyze because we have to go deeper. Like, for an example, I may say Jupiter is afflicted.
Yeah.
If Jupiter is afflicted, then it could be your jaundice, it could be your diabetes. So that has to, we have to go deeper, and somewhat we should have some knowledge of medical science.
Yeah. The next.
Then only we can.
Yeah.
Next is the grade of the disease. Grade of the disease means severity. Every consultant or a patient wants to know how severe it will be.
Yeah.
And severity means grading. Grading in medical terms, it could be grade 1, grade 2, grade 3 or grade 4,
Yeah.
whatever the grade they have.
Yeah.
And in our terms, it depends on the nature of affliction. The more the affliction, the grade will be higher.
Oh.
And we can say that this is the long-lasting disease or incurable disease, or it will go somewhat longer, or it will not be cured, because by seeing the successive dashas and transit. And secondly, in this area, a consultant want to know about the outcome of the disease. What it will be happen after I catch the disease. So we can pinpoint by seeing the dashas and transit whether the benefic dasha is coming or benefic transit is coming, so that he will be getting cured or not.
Okay.
But medical fraternity in this area is quite competent, because they can chart out the course of the disease, and they can say that by seeing the grade of the disease, they can say whether the patient will be cured or not.
Not cure.
Like in case of cancer, if the grade 4 is there, then doctor may probably say that you will have 3 months or 6 months depending on the condition.
Yeah.
And we can also safely say by seeing the dasha and transit that you have the 3 months or 6 months, whatever it is.
Okay, got it.
Yeah. Last one is the management of the disease. Management of the disease. What treatment should be there? So, as a student pursuing astrology, or as a common man, we always say to the patient or the consultant who has come that first go for the medical treatment.
Yeah.
Because in this area they are proficient. Medical fraternity is proficient,
Yeah.
and they can chart out the disease. But we, with the help of certain classic where the remedial measures are given,
Correct.
or where certain remedies are given, but that we can tell them the remedies. Remedies can ward off the pain which the person is suffering. So we can help the consultant also. And secondly, when if the remedy is working and the patient gets cures, that means that is the part of our study promise.
True. Okay.
So in this area, material pattern, one should, my advice is, and even Raos was specifically said to us that you should tell the consultant first go for the treatment to a competent doctor.
Doctor.
Yes.
Got the point.
We can advise the remedial measures there, which has been given in the classic. There are certain mantras like Surya mantras or Mahamrityunjay, etc., depending on the
Yes.
severity of it. But
Yes.
these remedial methods definitely ward off the pain.
Okay. Very beautifully explained, Vinay ji, in terms of how astrology can help in advance. You can be very proactive with your health, where astrology can be used, way before even the disease would manifest. The potential of what kind of disease would a person have, by timing, those occurrences in life. Diagnosis, as you said, there is nothing much to offer, but the areas where the problems would lie, from the horoscope, you can diagnose to certain extent, and as you said, Rao Saab had mastered this particular technique very well, and he has shared with a lot of people as well. Next comes the severity, how severe it's gonna be, from the chart also, depending upon the rashis, the play of the planets, and obviously the house, all the permutation combination in an astrology that we put across, an astrologer could say how severe or not severe that situation would be, when he will go through those dashas or those gochar, whether it will give a lot of trouble or it would be, it could be fatal for him, not. So those can also be predicted. And the last is the treatment. I remember reading one of the astrological works of K.N. Rao ji, where he gives an example of he prescribed somebody to do a Mrityunjay mantra, and when that actual incident happened after 5 or 10 years, I roughly remember now, that person was only hospitalized and then he got cured, which otherwise would have had been a fatal incident in his life, so so sometimes the astrological remedies do work, and in that work I think there were 3 things very clear, categorically and clearly told, that in that research work, there were some upayas that or remedial measure that were given that work, some part it worked partly, and in some it did not work at all. So that was a very nice book. I don't remember the name now, but
it is Faith in Astrology by Dr. Sita Kathir.
Right,
she is a qualified medical doctor, ENT specialist.
So we'll go to the next topic, which is the 12 signs.
The body part. The 12, the body part, our Kalpurush body is divided into 12 signs. How they have divided that, like Aries, the caption is the external domain, internal domain, and structural domain. External domain means the parts which are appearing to the human being. Those parts which are appearing to the human being. And internal domain means which are the inside the body. And structural domain, I mean the bony part, which is there in that particular sign.
The skeleton. So the skeletal, the whole skeletal of human.
Skeleton comes under this structural domain.
So beautiful. I mean, from a sign, you have to look at three things: the external domain, which is the look of the external look of a
About
person, of a body. The internal is
Yeah.
the internal organ, and then the bony structure of it, which is a structural domain, you call it.
Definitely, definitely.
Yes.
Like in Aries, external domain is our head,
Yes.
this part, head.
Yeah.
And internal domain is definitely brain,
Okay.
and structural domain is cranium bones,
Yeah.
which is we can say it is the skull.
Okay. Yeah.
Yeah,
Okay. So and in your presentation, it is very clearly we can see that as well. The
Yeah,
three
yeah.
parts. So this is the head of the boy, yeah, which is a basic,
Yeah.
and then the whole human brain, which is
Oh,
there,
human brain.
and
Yeah.
then the skull, which is there, which is very
Yeah.
clear.
This is the cranium.
Okay. Okay. Okay.
Then we move on to the Taurus.
Yeah.
External domain is our face
Okay.
and throat area. This is the area, throat area.
Okay.
And internal domain is our teeth, tongue, and oral cavity. And the gullet opening means the opening of the our food pipe.
Food pipe. Okay.
Yeah, the pipe which is open in the mouth.
Yeah.
That is gullet opening. And the structural domain definitely it would be facial bones,
Okay.
like cheeks.
Yeah. Okay.
Then comes Sir Gemini. External domain is shoulders, neck, and arms, hands, and the upper part of the chest. That is comes under the external domain.
Okay.
Internal domain is larynx, which covers your vocal cords,
Okay.
thyroid gland, which controls your T3, T4, and trachea, which is the windpipe,
Okay.
basic part which covers the windpipe.
Okay.
And in structural domain, bones of neck, shoulders, collar bones, and bones of arms and hand,
Hand.
which is revealed in the this diagram.
Diagram. Okay.
Yeah. Then it is Cancer. External domain is your breast and chest. Breast indicates of female and chest indicates of males. Internally, it covers lungs and heart. There is a controversy about heart. Many of the classics they say that heart lies in the fourth house of the Kalpurush. So it is definitely a Cancer. But some of the authors have given the heart in the Leo. But my experience is that heart always lies in the fourth house. So that is Cancer.
Okay.
And in the structural domain, we will have chest bones, ribs, back heart, upper spine. The spinal cord, that is the back area of the heart.
Yeah. So the heart is okay. The spine is basically divided into C, T, and L, right? So the C1
Yeah,
to
yeah.
C7 part of it. Yeah. Okay. Got
Yes. Lumbar region, thorax region,
it. Correct. Correct.
the spine is divided.
Yeah.
Then Leo is upper abdomen. Upper abdomen means the area between the heart and your navel cavity,
Okay.
navel. And internal domain, here lies the maximum very important parts, that is like liver, gallbladder, spleen, duodenum, small intestine. Small intestines come in the Leo.
Okay.
And the second domain is the mid part of the spine,
Okay.
which covers your lumbar region as well as your
Thorax.
upper. Yes.
Yeah. Virgo.
Then comes the Virgo. Virgo external domain is the umbilical region, means umbilical, our navel comes under this part, and lower abdomen, the part which is from the navel to the pelvic region.
Okay.
And internal domain is like kidney is there, and large intestine is there.
Okay.
And the structural domain, it is lower spine. The whole lumbar region will be there.
Okay.
But of lower part of the lumbar region is in the Virgo.
Okay.
In Libra, that is the external domain is the pelvic region, which we call as the girdle of V. And internal domain is your uterus and ovaries in the case of female,
Yeah.
and testes in case of males.
Okay.
And in the structural domain lies the pelvic bones. Yeah. Then comes the Scorpio. Scorpio is the eighth sign of the Kalpurus. So external domain means external genitalia. Genitals are our private parts.
Yeah.
And internal domain is genitals as well as anus is covered here.
Okay.
And in the structural domain, there is no bone in this area,
Oh, okay.
basically.
Okay.
That is why I left blank, that there is no bone in this area.
Absolutely, yes.
Then comes Sagittarius. Externally, it is hips and thighs, and internally, it is arterial system.
So,
All, yes,
yeah, in Sagittarius, this is something unique which I see. When you say the arterial system, the entire artery which comes under Sagittarius, is it? So,
yeah.
yeah. So,
Basically, the blood part comes under the your Cancer sign, fourth house.
okay,
So this is the sixth house from the fourth.
correct. Yes.
So arteries has to come here, and veins has to come in the Aquarius sign.
Okay.
This is the eighth from the fourth.
Eight. Yeah, correct. Okay. Okay.
And in the structural domain, it is the hips and thigh bone. Thigh bones are covered here in the structural domain.
Okay.
Then comes the Capricorn. Here the externally it is knees and hands, the part which is joining your pelvic region, and internally all the joints are covered here.
Yeah. So basically, it's a region from your hip joint till your knee. That the entire region which is there.
Yes.
Yeah.
But all the joints, any disease related to the joints, or even diseases related to the bones,
Okay.
they cover in Capricorn sign.
Okay. So it is okay. So the entire joint. That means the
Yeah.
elbow, it could
Yeah,
be
definitely.
So the whole body, wherever there is joint, that is ruled
There
by
is a
Capricorn. Not only the knee
Definitely.
joint, but the other joints as well in the body.
Other joints are
Yeah.
whole joints in the body.
Yeah. Okay.
And in the structural domain, it will be kneecap and joints.
Okay.
So kneecap is the patella part.
Okay.
Yeah. Then comes your Aquarius sign.
Okay.
Aquarius sign covers your externally, it is legs, ankles and calf.
Yeah.
And in the internal domain, it is the venous system and blood circulation.
Okay.
Basically, here I want to tell you that Aquarius is the second heart of the body.
Second heart of the body.
Yes, because from the calf, blood gets boost up to the whole body.
Correct.
That is why all the doctors and all the fitness gurus, they say for brisk walking. They advise brisk walking for the people
Okay.
so that your blood circulation will be much faster.
Faster.
Besides taking the oxygen in the morning.
Okay. So it okay. Aquarius covers the whole veins. Whatever is related to any disease that is
Yes.
related to the veins,
Yes.
Aquarius plays a role out over there.
Yeah.
Yeah, and
Structurally it is hard. Yes.
yeah, and for the arteries it is Sagittarius.
Arteries it is Sagittarius.
Okay, wonderful, beautiful.
Because there is a one classical combination in the classics that the presence of sun in the Aquarius sign will cause you the Hridaya Rog.
Oh, okay,
Now if you see the Aquarius sign, in the Kalpurush it is the 11th house.
correct.
And from there sun is aspecting its own house, 5th house.
Okay, yeah, right.
So there is a Parashara principle that any lord, if it is aspecting its own house, will definitely boost up the significations of that particular house.
House. Okay,
So that is why it is in Cancer, because from the Cancer it will be in the 8th house.
true.
So that is why we are practicing on it is my observation that heart should come under the 4th house.
Fourth house.
Definitely.
Uh,
Yeah.
okay,
And second heart is your calf muscles. So definitely they are in the 11th house, Aquarius sign.
okay,
So structurally we will have in the shin bones and ankles in this area.
okay,
Then comes your Pisces. Externally it covers your feet and toes, and internally the lymphatic system,
oh,
which is the part of the blood, and it is found in the whole of the body. Limbs are found in the whole of the body.
correct.
For detecting cancer, like if it is in the lymph nodes, we have to see Pisces and 12th house for that matter, for finding cancer in lymph.
Lymph nodes. Yeah. Okay.
Yeah. And structurally, they are the bones of feet and toes.
Okay.
So these are the 12 signs which are divided into a Kalpurush body. And somehow I think it will be explained how the externally it will come, internally what will come, and
Yeah.
structurally.
Yeah. This is, I mean, very beautifully put together in terms of the internal domain. Yeah, it opens up your mind that you do not divide the body just by the signs, and
Yeah.
the internally, for example, here we have which is Pisces, so where the entire body, the lymphatic system of the body comes under Pisces, so yeah, so the arteries, the veins, yeah, you have to
Yes,
focus on-
artery comes under the Sagittarius and veins comes under the Aquarius.
yeah. So this is really, yeah, good stuff to learn, very nice, yeah. So we move ahead.
Yes, definitely.
Okay, now you'll be sharing about the houses, the 12 houses.
Yes, the 12 houses of the
Zodiac.
horoscope, zodiac or horoscope,
Yeah.
they are also divided the Kalpurush body according to the particular house.
Okay.
So now we take the first house. First house covers your head, brain, and the entire body in general, means composition of a body. How much of that means how you look like, you will be a fatty, lean, tall. That is body in general.
Okay.
Hair and skin.
Okay. Okay.
So hair comes under the first house, but skin, the it covers two houses. One is your first house as well as your sixth house.
Sixth house.
Yes, so if you want to see some skin disease or some skin, any of the skin disease, then
Okay.
you have to look for both the houses.
Okay. What is the technical difference between the first and the sixth when you want to look at the skin?
See, basically, because it covers the body in general, so that the lagna will become the primary house.
Oh, okay.
Secondary is because Virgo sign falls in the sixth house.
Okay.
So definitely we have to look for the skin in the sixth house.
Okay.
That is the secondary house, not the primary house.
Primary house.
Primarily, we have to see from the lagna house.
Okay.
Next is your second house. It covers your face. It covers your both eyes. But I have put the right eye in the bracket. When we have to differentiate between the both houses, both eyes, sorry,
Okay.
then it will be right eye.
Okay.
Otherwise, both eyes covers in the second house. So second has to be afflicted for any of the eye disease, whether it will be in left or whether it will be in right.
Right.
So second has to be afflicted. So, but right, when we have to differentiate between right and left, then definitely second will cover the right eye.
Right. Right.
Then your teeth, tongue, oral cavity, salivary glands comes here, and your nose.
Okay.
Then comes your third house. Again, in third house, we have ears. Both the ears comes in the third house. Both ears.
Okay.
But when we have to differentiate between the left and right, so it will be right part.
Okay.
So right ear, but any of the disease of ear, we have to look for the third house first. That has to be approved.
Okay.
Then comes your neck, shoulder, larynx, vocal cords, then thyroid glands, windpipe, food pipe, upper part of the esophagus, and your collarbones and hands. They cover under the third house.
Third house.
Fourth house covers your heart, chest, lungs, and diaphragm. Now there is a difference between like windpipe is there in the third house and lungs are there in the fourth house.
Yeah.
So any disease arising in the lungs, we have to look for the fourth house. And any disease happening in the windpipe, we have to see the third house. That is the difference.
Okay. Okay. Got the point.
Any then comes to the fifth house.
Yeah. Just give me 1 second.
Okay.
Yeah. There.
Fifth house is your upper abdomen, gallbladder, liver, pancreas, spleen, small intestine. Means all important part of the body are there in the fifth house.
Okay. Pancreas remind me that the most common disease now everybody is suffering is diabetes.
Yes,
Probably we can do a
and
video completely on diabetes someday with you, sir.
in instance also, I along with my father went to some big of the Times of India group when I was a child.
Oh, okay.
Uh, his family lives in the posh colony in Delhi. When we went to his house, he has offered us tea and all the snacks. But
Okay.
he was only eating Mary biscuit and paneer is put on the Mary biscuit. I asked my father afterwards that we have been served with the so delicious snacks and he's only having this
Mary
Mary
biscuit.
biscuit and paneer. So after that, my father told me that he must be having diabetes. So that reminds me affluent people have the disease earlier.
Yeah.
But now it's a very common disease amongst
Yeah.
uh, our Indians.
Yeah. I mean, yeah, one of the gift of science to us, which has made our
Yeah.
life easy. And but yeah, you get all these things in life as well.
Yes,
Yeah.
definitely.
The sixth house.
Then comes the sixth house. It covers your large intestine. And the appendix, which is a vestigial organ of at least nowadays of no use to us, even in the foreign country, if they get the opportunity, then they remove the appendix from the very first instance.
Oh, okay.
But it has apparently nowadays appendix doesn't have any function in our body, but the inflammation of appendix, if not cured in time, then it may lead to the death.
Yeah.
So in foreign countries, they remove it on the very first occasion.
Okay.
Kidneys also comes under the sixth house.
Okay.
And there is some controversies between authors that kidneys comes in the sixth house or seventh house. But in my observation, kidneys are definitely comes under the sixth house.
Sixth house. Okay.
Yeah. Then comes our seventh house. It covers uterus and ovaries in the female and testes in the male and our prostate gland and urinary tract.
Okay.
And now in the sixth and seventh, urinary tract come under the sixth house. Oh, sorry, seventh.
Seventh house. Yeah.
Sorry, seventh.
No.
And kidney comes under the sixth house. Now, if there is any inflammation in the kidney, we have to say sixth house. And if there is any problem or in the urinary tract, like some stone in the urinary tract,
Yeah.
then we have to see seventh house.
Seventh.
If the stone is in kidney, we have to see the sixth house.
Sixth. Ah. Okay. That's the technical difference.
Yes, that is the technical difference.
Okay. Okay. So yeah.
Now-
So usually people who are having stones, for example,
Yes.
the stones usually over a period of time will travel to the urinary tract. It will move from the kidney down, right? Because and people usually associate stones with the kidney. So they say, look at the sixth house. No, but technically it has traveled down. It has come down to the seventh.
It has traveled.
Yeah. So
Yes.
that's the reason seven. Yeah. Very nice. Yeah.
Yes.
I understand.
Then comes the eighth house. Eighth house covers our private organs, external genitalia, secondary sex characters like our moustaches and we can call it as pubic hairs and seminal vesicles
Okay.
and rectum,
Ah.
the end part of the colon or you may say large intestine,
Yeah.
where the excretion has to be take place. That comes under the eighth house. Now comes the ninth house. Here again the hips are there, thighs are there, and arterial system is there. And I have told you the difference because the arterial system, which is sixth from the fourth,
Yeah.
blood we take from the fourth, and because heart is there, and it is the sixth from the fourth, that is why it is artery,
Yeah.
which carries your oxygenated blood, and this is about the ninth house.
Yeah.
Now comes the 10th house, which is our karma sthan. It covers your knee and joints, and then patella, which is the upper part of the knee,
Neat.
and orbital fossa is the technical term, medical term, which is the lower part of the kneecap.
Kneecap. Okay.
Yeah. Then comes the 11th house. It covers your legs and as well as calf, and when we differentiate between the right ear and left ear, then it is left ear.
Okay.
And our vein system, all the veins are governed by the 11th house.
Okay. But overall here you said you should look from the third house. Any issues?
Yes,
Yeah.
if there is any affliction even to the left ear,
Okay.
first we have to look for the third house affliction.
Third house. Okay.
Meaning thereby that only 11th house affliction and no affliction to the third parameter will not suffice for any left ear problem.
Problems.
Problem has to come from the third house only.
Okay.
But which year, that you have to differentiate between the third and 11th, and the differentiation is of the significators.
Okay.
And the last one is our 12th house. It covers our feet and eyes also, left eye. Left eye means when we have to see any of the eye disease, it is the second house. But when we have to differentiate between the left eye and right eye, it will be the left eye. And our lymphatic system, that also comes under the 12th house. One more thing I want to add here, that some of the authors and astrologers, they are established astrologers as well.
Okay.
They say for female it will be a right eye, and for male it will be a left eye.
Oh.
But in my opinion, there is no distinction between male and female.
Ah. Okay. Okay.
Yes. So now we cover all the 12 houses and 12 signs.
Yes. And yeah, we come to the end of today's lecture on medical astrology. We'll continue with this series. This is just the start in relation to medical astrology with Vinay Gupta ji. We have covered so far. We have covered the signs. We have covered the houses. So in the next episode we'll cover planets. So in the next video, we'll cover the planets. How the 9 planets plays. What do they signify? What is their role in terms of the body domain and the disease related to
disease.
Yeah, so that's what we're going to cover, and we'll touch a little bit on you said on Ayurveda as well, because each planet is assigned to the Pitta, Vata and Kapha principle of Ayurveda. So we'll touch on that topic as well.
Yes, for the sound immune system, we have to cover that sound immune system also.
Okay.
And before venturing into the horoscope, certain how I look or we should look.
Okay. So then we will leave this to our viewers to send us questions which we can post it to Vinay Gupta ji, and we'll surely answer. I am sure there is going to be a lot of questions which people would want to ask. The health issue is very common in nowadays. People post on the YouTube, and we'll take it forward from there. Thank you so much for being with us today and sharing your knowledge. Thank you so much. On behalf of
my gratitude. Saptarishis and Sunil ji and Raos sir, that they allow me to have some of these sharings.
Yes, thanks to them as well. Absolutely, yes. We will look forward for more knowledge sharing with our Saptarishi viewers, and see you for sure maybe in a week's time once again. Yeah. Thank you so much. Thank you so much. Pranam.
Thank you so much.
Yeah, thank you.
Pranam. Thank you. Thank you so much.